Good evening, everyone. This is Dr. Mansi from Homeopathy 360. We are back again with the another wonderful session we are going to have with Dr. Pallavi Gijare, ma'am. Ma'am, a very warm welcome to you and thank you so much for coming on this platform.
Thank you, Dr. Mansi.
And today we are going to learn about the very interesting topic that is abscess turned into an ulcer. A case of mammary abscess turned into an ulcer, which is a very new topic, and we are going to learn again. So let me introduce Dr. Pallavi Gijare that she did her BHMS from MUHS, followed by MD Homeopathy from YMT Homeopathic Medical College and Hospital, Kharghar, Navi Mumbai, with more than 24 years of clinical experience and has successfully treated many patients of acute and chronic ailments with homeopathy. Dr. Pallavi ma'am currently practicing from Thane, Mumbai and is specialized in treating patients related to lifestyle cases, women's problems, skin problems, cancer, hormonal imbalance, and many more. She gives adequate time in studying every case by taking a complete history and understanding and with holistic approach. On the basis of logical and scientific approaches, she provides the best solution in treating. She is a very dedicated homeopathic doctor with an excellent track record of providing good results, and we are very proud of Dr. Pallavi Gijai ma'am. She is also associated and mentor in the HHF. We are very happy to have this webinar series in the collaboration with HHF. I welcome to Dr. Pallavi ma'am again.
Yes, thank you, Dr. Mansi, for such a wonderful intro. And
Thank you so
I
much.
really, congratulate BJN for taking this initiative to spread homeopathy far and wide. Hmm?
Thank you, ma'am. Thank you.
Yes. So I think, should we start? We have almost
Yes,
71
ma'am.
attendees. Okay.
Yes, ma'am. Sure. Please start.
So, good morning, my dear homeopaths. Belonging to the same fraternity where we all share a common goal, of healing humankind. We have a
Yes.
wonderful science, a science which has such a big legacy that our Dr. Samuel Hahnemann, right from 18th century, just unbelievable what a visionary he was. That till date we are able to apply those basic principles and successfully we have in HHF imbibed all those principles and clinically.
Hello, ma'am. Is your mic is mute?
No, it's on.
Please check.
It's on.
Or it's just me.
Are you able to
I'm not.
hear now?
Uh, Anyone from the attendees? Can you please confirm, ma'am is audible?
Hello. Good morning. Am I audible? Yes. Can you hear me?
Yes, I'm out there.
Yeah.
Yes,
Okay.
yes, my error.
Okay. So hello everyone. Uh, So thank you for this beautiful opportunity to share this experience and knowledge which I have gained and through all my mentors in HHF. Uh, with gratitude to Dr. Samuel Hahnemann, a real visionary, who could really see far beyond just the human body, and he was able to understand the subtle existence. And that is why we are having our beautiful remedies which can act at the subtle level. So this is a very beautiful case where we all will learn what really magic homeopathy, not just magic, but it is actually the science which really can go to the deepest level. Hmm? So I'm sharing my PPT, and along with that, I will keep giving my inputs. Am I audible now?
Yes, ma'am, audible.
Okay. Okay. So I'm starting the slideshow. Is it visible?
Yes, ma'am. Perfectly.
Okay. Yeah. So, seeking blessings from my masters, uh, Dr. Milind Rao sir, Narendra Gupta sir, and Dr. Mohanty sir, from whom we have really learned about homeopathy, about human emotions, and how to lead a life of our own also. It has changed the perspective totally about how to live and understand the other person. Okay, being a layman is what we have learned from them, because I can understand the patient sitting in front of me only when I'm sitting as a layman at the level, at the vibrations at which that person is talking to me. And gratitude to my entire HHF family, because the study and the depth and the research that all this entire HHF family has been doing day and night. We literally eat homeopathy, sleep homeopathy, day and night we breathe homeopathy. So all this knowledge is a culmination of everybody's thought process, everybody's experience. My heartfelt gratitude to them, and most importantly, gratitude to our patients also, because they are the one who really teach us about life and also about the remedies. So today I'm presenting this case of a mammary abscess. I'll give a small background because the case was entirely taken on a call. The patient stays in a remote town near Panchgani, and a patient could not travel and come here. Okay, so she is a 32-year-old lady. She's a teacher in one of the schools over there, the residential schools. And initially, it was her like mother-in-law who knew me, and she used to tell me that my daughter-in-law is not keeping well. But this patient never, came up or even spoke to me on the call. And then one fine day, finally, her mother-in-law only forced her that no, you should talk to the doctor at least on a call. So she called me and then she started narrating. So she said ki for 1 week she did not tell anyone that she was having abscess swelling on the breast. It had started oozing. There was pain, fever, and she said ki at home also she did not tell anyone. She continued with her routine work at home, going to school, everything. She said she even refused to go to the allopathic doctors in that town because she said there's only one male gynecologist in their vicinity, so she did not go to him. And she also narrated that everything started after her mother's death. So her mother had died 2 to 3 weeks back. Her mother had arthritis and she used to take a lot of painkillers, and finally she landed up with chronic renal failure. And as a reaction to the medicines in the hospital, she expired. Now this event had left a lot of deep impact on the patient's mind. Okay. And this patient, then she said, ki, but this patient was not able to go and see her mother who stays in Mumbai, because it was the same time when the patient's sister-in-law had come to that town for delivery. So she had to be in her town with her in-laws. And by the time she reached Mumbai, her mother was almost breathing her last. And so she was quite shocked seeing her condition. And she was going through a lot of anxiety since that time. So now she sent me these pics before starting. So you can see this abscess had started forming initially, then it opened up. This was all before pics were taken, even before she came to me. And gradually now it has started opening up. And she had a lot of pain. So now she said, I had asked her, "Ki, what exactly are you feeling now after this incident?" So she said, I'm feeling guilty that I was not able to help my mother or be with her or take care of her. She was also angry about the whole situation that her in-laws also did not allow her to go early. And plus, because of this incident, she had developed a fear of taking allopathic medicines because she had that idea in her mind that her mother went into renal failure just because of allopathic medicines. Yeah, are we together till here? And am I audible?
Yes, ma'am.
Okay, so
Uh,
let's move ahead. Now, next, I asked her why you're avoiding going to a doctor nearby. And especially, why are you not taking allopathy? Because her mother-in-law said ki we were willing to take her to a hospital. So she said, nay, the modern medicine doctor will, I know it, they will advise me surgery. And frankly speaking, we are having a lot of challenges financially. So we have little money and even there is no help. The distance, because they stay in a small town, so every day they will have to travel till that hospital. Then she said that there is very difficulty in taking leaves from her job, and again if she becomes bedridden or something goes wrong, who will take care of her? So all these thoughts were going on in her mind, even when she was in so much of pain. Now just see to it that she is in pain, she is suffering, she has such a big pathology, but she's thinking about all the surroundings. Then she said she refused to do a video call. And she never came to the clinic, even when I insisted at least once you can come to Mumbai. But she said no. And she was not even opening up and sharing her entire history easily because she stays in a joint family, in-laws, one son, husband. So she used to really reply in short lines, yes, no, but never in an elaborate way. So I told her, at least send me the pics. Let me at least be in touch ki how things are progressing. We'll start with the treatment. There was another challenge that we tried sending her medicines by courier, but in that remote area, even the courier never used to reach on time. But in spite of all this patient refused to go to the nearby allopathic doctors. So this is also very significant part of the history. Now the ulcer gradually, I'll show the next pic. The ulcer, it opened up, abscess opened up, the ulcer started forming. It kept on increasing. So I told her that she really needs to get her dressing done. And if you really feel, you take help of the nearby doctor, take antibiotics, no problem, we can do everything. But she was so clear that I will not go to any other doctor. Okay. And then one fine day, she finally called up on her own. So this was the next stage, which it had already reached. You can see that ulcer is deepening, blackish discoloration around, slough is there, pus formation is there. So when this state came up, then she called up for the first time on her own. Okay, so now this is the verbatim of that phone call, where the actual remedy started. I started exploring. So she said when she was cleaning, she used to clean on her own. So while cleaning, that ulcer, that slough was removed, and that little white discharge also started coming up. And then she said, when I saw that hole, I was scared. And she said, I cried. I couldn't bear the pain and the burning. And I was really worried how many more days it will take to recover. She started getting now irritated because all this was going on since almost a month. She said, I'm trying to push myself to go to school, do her work, but now because of that pain, she cannot lift anything heavy. So constantly she has to ask people at home or somebody to help her. Then she said, I started feeling helpless. Then I started becoming so irritated that if my son asks something, I scream at him, yell at him, or somebody at home, husband or in laws, tell her some additional work. She said, I used to get extremely angry at them and I used to feel, why don't they just do things on their own? Why are they telling me to do it? So son also kept on used to keep on asking questions, and she said, "I tried to calm down. Or at least I should not yell like this at my in-laws or even." For she was feeling that she used to have that repentance. Ki, why am I scolding my son for small things? And one fine day, when she called up, her son said he saw her in pain. He was hardly 6, 7, or 8 years old, and he said, "Oh my God, mom, you're in so much of pain. So are you going to die?" And when she heard this, that time she said, "Yes, now I cannot really remove my anger and irritation and show my son this state." So that is the time she became really serious about taking the treatment. So I knew a little bit of background from her mother-in-law that her husband actually does. He is a well-educated, but he doesn't like doing a job. So he was running a small garage. And he had a lot of friends. So he used to, give lakhs of rupees as help to the friends. He used to even take a loan on his name and give away to his friends for their work. And those friends never gave back the money. So now, father-in-law also retired, mother-in-law is retired principal of the school. So now she is the only one who is taking all the financial responsibilities to the extent that the EMIs of the loan that was taken by her husband for his friends, she is paying the EMIs. Then she goes to school, does all the household work. And so I was really wondering what this lady is going through. Then she said her husband is searching for a new garage place, and 2 to 3 months he's sitting at home, and actually I'm throwing my anger at times outbursts on him, but there are no arguments amongst us. So I was really surprised, that even in so much of pain and so many challenges in life, this lady is speaking in very nicely, politely, very fluently in English. Uh, I was really wondering how come she is able to speak so softly even in this situation. Okay, so she said ki I asked her then you have the option of coming to Mumbai because her brothers and all are in Mumbai. She can definitely get a better pay in Mumbai and she can have a lot of other a better life. So she said, "No, Mumbai, living in Mumbai is costly, and my husband doesn't like Mumbai because and he will never come because he doesn't like to do a job." And then she started giving all other reasons. And then she said, "Nee, in the benefit here in Pajgani school is ki I am a teacher here, so I don't but the son's fees are also very less. So, I think another 4 to 5 years I'll pull on here only in this small town. I have accepted this situation. And currently, I feel there is no way out of all this." And then she said, "I try to keep quiet. I try to avoid quarrels. Because if I don't keep quiet, then clashes, quarrels, everything will continue." And also, there was another challenge that she has two sister-in-laws. They are in Mumbai. They are doing a job. So whenever their children have holidays, they send all their kids here to her place. And then she has to take care of the other kids also, and in that she has to do her job. And plus then she said ki she's cooking, taking care of her sister-in-law's children also. And whenever sister-in-laws come, they all go out. Her husband, mother-in-law, sister-in-law, they all go out, and she is left with their kids handling everything at home. And nobody asks for her any opinion, or they don't even ask her whether she would like to join them, see anything. So all this thing she has been going through very quietly. So she said, I try to see that the situation of argument doesn't arise. Also, another change that happened at her workplace was her mother-in-law's sister. She joined there as the head of department where this patient works. And she used to, keep scolding her, pointing out her mistakes in the department in front of all. And she said she never came home and told anyone about all this because she thought ki she is mother-in-law's sister. How can I complain against her or back answer her? So she used to get irritated, frustrated from work, come home and again manage everything. And then later on, mother-in-law came to know about all this from somebody else that her sister is bothering her too much at workplace. So the mother-in-law told me about this incident. So now you can see what type of personality this individual is. Hmm? So I was continuously thinking at one point, ki, why is she bearing so much? She's a well-educated lady. She is young. She's taking so much of effort. So why is she not taking a stand for herself? Mother-in-law is criticizing, mother-in-law's sister criticizing, then taking care of the entire family. Husband is not working. She has the option of getting back to Mumbai, but she's not coming up. So I was trying to understand the why of the case now. Is it okay till now? Any queries in the case till now? Hello, Dr. Mansi? Hello? Uh, yes, Dr. Rachana? Hello? Am I audible? Hello? Yes, Dr. Akansha? You can unmute Dr. Akansha. Dr. Dr. Rachana?
Yeah, you're audible, ma'am. You're audible.
Yeah, yeah. Okay, okay. Any queries till now?
No, no, it's all
Oh,
correct.
okay, okay.
Understandable.
Yeah, so we'll continue. So now we have to find the answer to all these queries. Hmm. Okay. So now as we know that till here we came to know about all this. She said, I am not a person who can really put forward my points properly in any argument. So I keep quiet. And my now focus is only one thing. I want to be healthy so that I can take care of my son's studies, get back to work. And I don't want my mind to be distracted from my work because this job is very important for me. Hmm. So just from this history, I started thinking about the rubrics and what all we can think about this. So first, like yes, everybody will agree that she definitely has anger inside, and that she's not expressing very freely, openly, not talking about her emotional conflict that she's going through. And any other thing anybody would like to put forward their points or any analysis? Okay, fine. So from here, so these were the few points which I came up with. Hmm. First, she's embarrassed, definitely because of her ailment, something that she is not able to show anyone, tell anyone, and she is not even opening up, sharing her issues. So she's embarrassed about her complaints. She has that anger with silent grief. Thirdly, yes, she has that fear of doctors, as she had mentioned about her mother's history, and this that she will be asked to undergo some surgery or undergo all the allopathic type of medicines or hospitalization. So this we can take as fear injury being injured, and she was asking how long will this continue. And in the whole situation, the way she was speaking and still she was working, so that itself shows that her self control is definitely very high. Then other attributes which we can think is quarreling aversion to, then reason increase power of. So this rubric means where we can see this, she gave such a nice explanation when I asked her, Ki, why aren't you shifting to Mumbai or why are you bearing all this? So she gave a very clear cut explanation and reasoning that कि I can't go because here my son is getting his fees are less. Then they have their own house here, so rent she doesn't have to pay. Her husband will never go and work or do a job, and he won't like in Mumbai. And she also explained, okay, I have to spend another few years till my son completes 10th standard, and then they may think of shifting later on. So she has a very clear-cut understanding that, and she was reasoning out, ki, why am I still holding on here in the small town? Another very good rubric which we can think of is fishing inaptitude for. What does fishing mean? What does, whenever we go out for fishing, what do we do? That, we have that fishing stick, and we just put it in water and wait for that fish to get stuck. If we have to apply this analogy, ki there are certain personalities who really know, how to manage the situation in such a way that it can be of my benefit, right? But this individual, if you see, ki she is just giving in to all the pressures and the demands of the family or at work. So she is not able to, we can say, really play with other people or delegate work or handle the situation. So that is why this is fishing inaptitude for. And this next is the cowardice opinion without the courage to express her own. That is also very clear because she herself says, ki, I cannot put forward my point of view. Then hiding things. How can we apply this to the cases? Because she has not been revealing anything. She was not willing to give the history also initially. Even she never spoke about her family or anything. It was last after a month, and when her son said, ki, Mama, are you going to die? That was the time where she felt, nay, now I should really disclose my stress or the whatever emotional stress I'm going through. Then she started telling the story, what is going on in her life. Then too polite, that was her how. Helplessness feeling, fear of losing a lucrative job, because I had asked her, why aren't you taking some medical leave, take a rest at home? So she was like, no, there is a lot of work pressure, a lot of competition, and I need that job. That is very essential. And in all this, throughout, she has been taking care of all the family members in spite of all this. So cares full of others about and anxiety others for. Now, next we come, finally, still the question remains, why she is not taking a stand for herself or for her rights. At least when she is doing everything for everyone, somewhere she can open her mouth, somewhere someday she can say, okay, no, I can't take up so much of work, right? So do we have any rubrics which can qualify this state? She is now, when she's so sick, then also she is doing everything. Imagine her husband has taken the loan. She is paying the EMI from her salary. So she can flatly say no, but she is not taking a stand. So which is the rubric that will really qualify this state, her adaptation? What we call this as adaptation to the state. So one thing is she has been serving everyone, and how that she's pleasing everyone, sister-in-law, mother-in-law, everybody, husband also. Actually, she can even point out, argue with her husband why he's not taking responsibility of the son, paying fees or running the house. But no, she is, what we can say, serving the family members since many, many years, since the time she got married. So the appropriate rubric for this adaptation is being servile. Okay, so this rubric servile means wanting too much to please somebody and also obey them. Because this we have to differentiate from the rubric pleasing, desire to please. Okay, so pleasing is one level and servile is still deeper. Like they are eager to serve and please someone else in a way that shows a lack of respect to yourself. That means you're not giving yourself any value, any priority, and totally in a humble way, totally you're serving the other person. That is the meaning of this rubric, servile. And there are two more rubrics. As we said, not taking a stand or not giving priority to your own self. So the rubric for this, where we are not giving priority to your own self or denying your own needs. This is her basic need now for her mind and body to take rest, to take treatment. That also she is ignoring. So this rubric is self-denial. Okay. So these two rubrics, self-denial and inhibition, both these rubrics are there in this remedy. So self-denial is very clear. The rubric means that the act of not having or doing things you like, either because for moral reasons or religious reasons or due to less of money. So in self-denial, there is a lot of sacrifice. So we have three remedies in this rubric: Staphysagrea, Agaricus, and Podophyllum. There's another rubric, inhibition. That means where this individual has the capability, okay, of doing things, getting things done, or whatever they desire for, they can do it. But because of the circumstances, what they are doing is they are restraining themselves, slowing down their gratification. She is also, what she is doing, she can live a comfortable life if she decide to कि मैं मेरा बच्चा और husband को आना है तो आ जाओ, we'll stay separately, I'll take care only of these things. But no, what she is doing, she is totally slowing down her gratification. नहीं, मैं अभी another few years I will continue in the same way. Okay, so excess, just for example, to understand the meaning of the word inhibition, where do we use when we studied central nervous system? Okay, the neurotransmitters role in inhibiting the impulses. So there is impulse to dampen the activity or to reduce the speed of the activity. So here also we have these three remedies in inhibition: staph, ambra, and lachesis. So now if we want to differentiate these remedies, we have to understand why do they do this. So this is just another meaning. Inhibition means the act of stopping or slowing down the process. A little bit detail is just about the different meanings of the word from the dictionary. And why does a individual behave in this way? Okay, why do they really restrain their impulses and the behavior? So many a times this is because of the childhood conditioning. Okay, so this is just the same example from the view of psychology, where if you do a psychoanalysis, here our super ego tells the ego, no, that you cannot do everything that you want. You have to control those instinctive impulses. Okay. So the next question comes that husband's irresponsible behavior, paying his EMIs to avoid. Why she was doing this? Because because everything, if that EMI is not paid, then automatically people will point out, the bank people will come home, and it will create a scene, right? So this qualifies the next rubric, sensitive opinion of others too. And why this personality is so sensitive to what other people say? So we have to go on asking ourselves why, till we reach the core of that case. This is how we can reduce the number of remedies and come down to one remedy. So the reason for this is being dignified. So if we now combine these three rubrics, see, there are a lot of peripheral rubrics as I had shown earlier. We can take key elements from embarrassment, anger suppressed, etc., etc. But these are peripheral rubrics. But if I want to understand the why of the case and what is her exact adaptation, so only these three rubrics are there: self-denial, inhibition, and survival. In that situation, this is how she is adapting. And if I combine these, we come up with the remedy, Staphysagrea. So these are the various combinations of the rubrics if we do and how we come to the remedy, right? So Staphysagrea, such beautiful colors, flowers, and so is the remedy, the personality. Very polite, very sweet to talk to, very polished. They will always behave in a very dignified way because Staphysagrea always feels कि मैं कुछ हूँ. मुझ में वो एक dignity है. What is the difference between, say, dignity, egotism? So all these things, say dignity, how do we use the word dignity or dignified is it is something hard earned. I have taken efforts. As we say, dignitaries on the stage, on the platform, that means somebody has earned that honor. I am dignified. I do have, like, I am worth it. So Staphysagria already feels कि I do have that sort of level in me, and that is why I should behave in that level. Okay, that is why they will always behave in a very, talk in a very respectful way. The way, because this lady, when she spoke on the call, she was so polite. She was, perfect English. I was wondering ki a lady in a town, and though she is a school teacher, yes, but such fluent English, and the way she was explaining, she did not raise her pitch. She did not even cry when she was giving her entire history. Very, very much controlled. So that is how a dignified person presents. So we gave her Staphysagria 33 doses, 15 minutes interval, and then once a day for 6 days. Then we kept on observing her. Gradually, all the discharge stopped coming, and healthy granulation tissue started coming up. But somewhere emotionally, still her fears, still all her, that was not getting sorted out. So I gave her Staphysagria 1001 dose. Again, I waited for 15 days. And then, like this, it came to a standstill. The wounds, they started healing, healthy granulation tissues, and this started. So now I needed a further push for complete healing. So then I started with Staphysagria LM potency, repeated daily twice for 15 days, and then once a day for a month. So now gradually her ulcer started healing. So now you can see from within it has started healing. This healthy pink tissue started coming up. All that blackish discoloration has also reduced, and finally it completely healed. I'll show you the images later on. Detail, almost day by day images are also there. And after about 2.5 months, she was completely cured. And this is after almost a year. Again, I had just messaged her just to find out whether our remedy has really healed her completely. So she said ki there was no recurrence of the ulcers, there was complete healing, and she was very happy. And now she was able to put forward her foot and do, prioritize her health also. So that is a complete healing. So now we have to understand ki what is the crux of Staphysagria. The crux is being dignified. So why they can't say no, why they are not able, they go into the phase of self-denial is just because they are too dignified to behave in a very rude way, talk in a rude way. So behaving in a calm, serious way that makes other people respect you. जब हम दूसरे को रिस्पेक्ट देते हैं, अच्छे से पेश आते हैं, तो obviously the other people will also respond in the same way. Okay, clear till now? Now let us see ki when the case was going on, different remedies come up in our mind. Ki she was initially I thought ki she's bearing all the suffering so much, keeping quiet, doing her duties. So probably Ignatia also came up, or maybe when we think of dignity, then we also think of Natrimure. So what are the differentiating points? Yeah. So what are the differentiating points? Yes, I think somebody has raised her hand. You can unmute and speak. Somebody would like to add or ask a query?
Ma'am, student can add the input from the
Yes,
question
yes,
and
why
answer
not?
box.
Why not? Yes, please.
If anybody want to ask something to the ma'am, you can write your query in the question answer box. Please write.
Okay. Okay. So now just let us understand. See, because retrospectively like this, when we are listening to a session or when we are retrospective thinking back, and there is a flow to the story, we are able to come up to a remedy little easily. But when the patient is in front of you, and see, all information may not come on at the say in the first sitting when we are taking the case, right? So there are n number of different remedies that come to our mind. So how do we differentiate, that is very important. Hmm? So let us go through these differential remedies. So first is, I had thought of Ignatia, also did come to my mind. But we have to think ki Ignatia is in the rubric dancing. And what does Ignatia do? They love, it is there in the rubric delusion, married he is. That means ki Ignatia lady, suppose now in this situation, she would have come, Ignatia would have a same, come with the same pathology. How she would have adapted? So she would have said ki once a lady is, for example, usually Ignatius feel ki if I'm married, this my husband's entire family is my family. Okay. So because morally they are very sensitive. So they feel it is I can manage it, I can do it, I can take care of my family members, whether it is household work, financial responsibility, everything. And she enjoys dancing for the family and providing for everyone. And that is why Ignatia feels ki अरे थोड़ा बहुत कुछ सुन लिया, even if there is suffering, she will never complain about it, right? So Ignatia does everything for the family relatives because she has high moral values, a very strong sense of right and wrong. But mind you, ki Ignatia is not there in ambition, and in later stages, she keeps on doing, and then finally she feels ki, अरे nobody appreciates her. या किस usually a typical word Ignatia uses is कि जानियो नहीं है. My family members are not even aware of my sacrifices and what all I have done for them. That time she goes into a disconcert phase. That means she totally breaks down and she stops doing everything. So Ignatia goes into a disconcert state, whereas Staphysagria will keep on giving and doing because Staphysagria is in the rubric servile. Like a servant, she will keep serving them. Okay, but mind you, Staphysagria in the end, itna suppressed anger, suppress, then the volcano definitely bursts out, and when they become angry, they can be very abusive and they really can insult the other person like anything. यानी जितना रिस्पेक्ट वो दूसरे को देते थे, जितना डिग्निटी से दूसरों के साथ पेश आते थे, when they were under control. But when they go to the other state की fear of losing self control, and जब उनका volcano पूरी तरह से बाहर आता है, they can behave totally in the opposite way. Then injustice cannot support, they can quarrel also, and they can really be nasty. यानी सामने वाले की पूरी इज्जत निकाल सकते हैं. इतना एंगर सैग्रिया का वॉल्केनो फूटता है तभी आ सकता है. Okay, so this is just a pic of Ignatia. She is happily dancing, doing all the multitasking. But when she goes in the disconcert state, she stops taking interest in everything and goes into that state of typical depression, low feeling, not interacting. This is the pictorial depiction. Now let us see if we consider from the angle of dignity, dignified people. So Natramure comes parallel. So now just imagine ki in the same situation, what would Natramure do? The first of all, because this lady was not giving any information, as I told you in the beginning. So I thought, is she secretive? She is not willing to share anything. So why Natramure does not share her complaints or does not share anything about her family or other people? So as we know, Natramure does not like being pitied, being sympathized by others. So that is why they will never talk about the challenges or conflicts that are going in between the relationships. Because Natramure does not like any weaknesses being revealed to others. Like illness also for Natramure is a weakness and she doesn't want the other person. A very nice another observation about Natramure can share is if you try to probe too much ना कि अच्छा तो आप क्या हो रहा है आपके हस्बैंड के साथ कुछ आपको डिफिकल्टी हो रही है या घर में कैसा है कुछ टेंशन है तो वेरी इजीली ना दे विल डाइवर्ट द टॉपिक. And I'll share one Natramure lady what she used to do now. Eugene Natramure likes to do a lot of social service. Because why? Because that shows that exclusivity. Natramure is in the rubric exclusive. So because they want to show ki I'm a dignified person and I'm doing something different, something exclusive from the rest of the people, right? So she what she used to do, she used to immediately, if I try to ask any detail, she will take out her mobile and she will tell, okay, see, these are the orphan kids now. We have given them some books and we teach them for free. Then again she will take out again for the next question. Then she'll say, "Arey, nahi, see, I have been doing this social service work also." So whenever I try to go in from any direction, she used to divert that topic. And what she used to show that, see, I'm doing some exclusive work. So Natramure in this situation, she would not have divulged any of this information. And but at the same time, Natramure is in proper to proper. The way they speak, they don't like fuss and they maintain their dignity. So in comparison to this, Taphysagria will give last preference to self-work and do work for others as she feels that if I please others, I will have that good name, opinion, and growth. That is social position in life. So Natramure is not concerned with that social position. She is only concerned maintaining her exclusivity. So this is exclusive. Now, for example, how will you just see? Exclusive person na cannot mix heart to heart with everyone. Like they will always stand out of the crowd. क्योंकि उनमें कुछ special. Whereas Taphysagria tries to be with everyone because they are trying to please everyone, they are trying to being servile. तभी तो social position के लिए people will say कि अरे ये this individual is such a nice person. They really work so hard. They are nice people. They are so then only they will get the respect. Next, yeah. So Staphysagria believes that I am some dignified person, has a lot of fantasies, dreams of being respected in society. So if you see the rubrics in dreams and fantasies, you will have plenty of these in Staphysagria. And this dignified way, then only people too will consider him dignified. So these two rubrics, which again are seen in Staphysagria: ambition, increased, fame for, and fear, social position about his. Just a thought, like Sepia is another personality who likes dancing for the family, but Sepia definitely wants appreciation in return. She wants ki, please consider me as a part of the family. I am a part of this family. That is why I'm doing so much. And then she finally lands up in the worn out state and then goes into indifference if she doesn't get that reciprocation. So this is how we have to think along the entire axis journey. Ki when they are in good health, when they are in that positive state of mind, then how if they don't get what they want, and then how is the downward journey. So now in a nutshell, if we see keys in one word, if I want to really describe Staphysagria, see, whether it was self-denial, inhibition, and servile, all this is adaptation, right? Again, as we said, we tried finding out ki why, so she is dignified. So what do these people do? Ki just to maintain their image, their position, their dignity, they have their own circle, what we can say. And boundaries hai. And nobody should cross that boundary, because if they cross their boundaries, they will hurt them, they will humiliate them. So rudeness, humiliation, as we know, all these things lead to ailments in Staphysagria. So we all have heard one of our renowned homeopaths, Misha Norland. So he has described Staphysagria in one word as violation. So let us understand, if we remember the word violation, you will be able to understand कि do not enter my area of dignity. उसको आप hurt मत करो. Okay. So he says, Dr. Misha Norland, that Staphylococcus aureus is concerned totally about this violation. Now, how do we use the word violation? Ki violation of human rights, violation of civil rights. That means there is some agreement. There is some way of behavior, doing things, whether it is by law, whether it is just an agreement between two people. Respect that. And anything that somebody does, the other person say insults, the other person just criticizes too much, then that my personal space is being invaded. This is called as violation. Okay, so that is why at a physical level also, if we see ki when we know na that Staphylococcus aureus on physical ailments, what do we say ki it is used for people suffering from say urinary tract infections or issues with the sphincters, and catheterization process, that is like putting a tube in your bladder. Yeah, so all this is your private body area which is being invaded by the doctors, and this is something which Staphylococcus aureus cannot take, and that is why they come down with the symptoms in this area. Okay, so now you can link the sphere of action of this remedy with the mind. And that is why Staphylococcus aureus has extreme pain and tenesmus in the invaded area. So lacerations, wounds, splinters, sphincters issues, all these things, they is something that they feel ki now it is really, and on similar lines, as we know, it is one of the best remedies used for rape victims. So this is the beauty of mind and body medicine. This is the beauty of psychodynamics. In short, I'll tell you ki psychodynamics ki why did she come down with breast ulcer? What is the purpose of breast? Is nurturing a child, right? Where the mother is using all her energy, her nutrition to nurture a child. So completely they are beings. It is similarly now here she was nurturing the family, husband, everyone, everybody. But they were the people who were just taking, if you see as a third person, taking advantage. They were not at all really that worried ki Are, she's alone pulling on everything. They were not asking her whether you'll come out with us. She was just being at home taking care of everything. So that that is why she came down with her breast ulcers and such a deep ulceration. I am almost heading towards gangrene. So that is the beauty, that is the strength of homeopathy, that this individual completely changed, completely healed. I think that was a wonderful healing process, and I learned a lot from this patient. Because in homeopathy, Dr. Milind Rao sir always used to say, na, anything that is deficient or anything done in excess, both will make you fall sick. It is comparable, like vitamins are essential for the body, but there is a range. There is excess vitamins will also lead to symptoms, hypervitaminosis. Similarly, the deficiency is also going to lead to a problem. So in our body, everything is a range, whether it is blood pressure, whether it is your hemoglobin, everything. So don't do anything excess or don't be too selfish. Just have the balance. So because the body also, as we all know, runs on homeostasis. So I think this is all about this remedy. I will just share the pics now. And any queries, do let me know. Okay, so this is yes. Any queries till then? Hope we can apply this
I,
remedy in different ways. Yes, yes, please. This is how it was deepening. And then the healing final stage. Yeah. This is healthy granulation tissue that came up and gradually completely healed, normal healing, normal skin color. That was the complete healing. Yeah. Yes, Dr. Mansi, do we have any queries?
yes, I would like to ask to
Yes.
all the students that please put your doubts and any questions if you have related to the case.
Yes, Dr. Amruta.
Hello, can you hear
Hello.
me?
Yes.
Yeah. So I just want to understand how she developed, like how her nature changed. Is there any change in her nature or the way
Yes.
she was doing it earlier before taking Staphysagria and after taking Staphysagria?
Right, right. So after Staphysagria, she started prioritizing her own health. Like she joined her yoga classes, and she said, "Now I can clearly say no. Today I'm not going to do this work because this is I want to take rest." And she started focusing on her son and her work. So at home, the way she was doing everything for everyone, now she was able to voice her opinion and say no to everyone wherever she felt that this is now crossing the limit. Does that answer your question?
Yeah. Thank you.
Any other questions?
Okay, this any even later on, if you need any clarification, that's my number. You can contact me. We can discuss and I can solve your queries, or in depth any other rubric you want to explore, even that we can do.
Thank you so much, ma'am, for your valuable time and the case and all the case taking and the presentation was really very, very nice. And we learned so much from today's session with HHF along with Dr. Pallavi, ma'am. Ma'am, thank you so much.
Yes. So thank you, Bijan, for giving this opportunity. And with so many delegates also, it shows that all these homeopaths are eager to learn. So we all grow together. That is the motto of HHF. So stay connected. And thank you, Dr. Mansi. Thank you. Okay, so should we log off, Dr. Mansi? Yes, Dr. Subhash, you've raised your hand. If you have any queries, do share. You can unmute and speak. Yes, Dr. Parul, you can unmute and speak. You can ask.
Good evening, ma'am.
Yes, yes, tell me.
I wanted to know how to differentiate between servile and selfless. Usually, I've been taking selfless when a patient presents when she is doing more for her family than for herself.
Right, right.
Um,
See, the word selfless, हाँ, the word is less. यानी खुद को सिर्फ थोड़ा ही कम प्रायोरिटी दे रही है. Okay, it is not lack. यू आर एबल टू अंडरस्टैंड द डिफरेंस बिटवीन द टू कि मैं सबके लिए कर रही हूँ, सेल्फलेसली कर रही हूँ, प्यार से कर रही हूँ, लेकिन थोड़ा बहुत खुद के लिए देख रहे हैं. इन सर्वाइल वी हैव टू ऑल्सो अंडरस्टैंड द वाई. कि सर्वाइल में ऑलमोस्ट लाइक अ सर्वेंट यू आर, कीप यू आर गोइंग ऑन गिविंग इट, डूइंग इट लाइक अ सर्वेंट एंड कीप ऑन प्लीजिंग. कि सामने वाला गलत भी कर रहा है तो भी चुप बैठ के आप सहन करके वो कर रहे हो. Okay, so we can say servile is still one step deeper as compared to selfless. Hmm. Is it clear? Yeah. Self.
yes, ma'am, I'll try. Thank you.
Yeah. Okay. It, yes. Somebody else also wants to ask. Yes, Dr. Vikas. You can unmute yourself, Dr. Vikas. Vikas. Yes, Dr. Vikas. You can unmute yourself and speak. Uh, Dr. Vikas, you can unmute yourself and speak. Okay, so I hope we have learned together and move one step ahead. So should we log off? See you and thank you once again.